Hi, this is Leslie Roberts. Thank you for working with us to do the maintenance contracts. I know everybody's very familiar with defibrillators, but what I wanted to do is just go over a couple of the details specifically related to the on-site. When you first look at the Philips OnSite AED, the light should be a green flashing light in the corner, which indicates that it's ready for use. You'll open it up and take it out, and you can see it a little bit better. On the back of it, it has the model number and the serial number. The model is the M5066A number, and you may see some that say an M5068A. I want you to write down that particular model number. The other one is the serial number, and for the on-sites it should start with an A. This says A17G, and what that means is it was made in 2017. So if you see an AED that says A04, then that was made in 2004. In particular, in the ones that were made prior to 2010, I'd like you to look at the back of the AED to see if it says the words Guidelines 2005 or Guidelines 2010. That will indicate to me whether or not the AED is up to date with current guidelines. The next thing we'll look at is the date on the battery, and this particular battery says install before 9/2019. What that means is it was probably purchased about 5 years prior to that, and it would have, if it was installed in 2014, then it would probably last until 2018. There's a 4-year life on the battery. I want to make sure that you kind of understand the install before date that we're selling today is 2023. So what that means is if you install it today, you have a 4-year life on them. That means it would expire in 2021. If you have a spare battery, then your spare battery, as long as you install it before the date on the battery, you're still warranted for 4 years of life. So if it's 2019 install before date, I could install it in 2019 and still get 4 years of life. That's a really important aspect. It's very confusing, so if you have any questions about that, please let us know. The next thing I want to look at is the date on the pads. It's right here, and this one is 9/2019. The pads are usually good for 2 years, and so you'll write that date down. There's also your spare pads here, and you're going to want to also note the date of the spare pads as well. And I think most of this client's going to have, will have spare pads and spare batteries with all their AEDs. The next thing I wanted to do is to do a battery insertion test. And we're only going to do that once a year. And to do a battery insertion test, you're just going to pull the battery out, and then you're going to put it back in, and then push the buttons.
Self-test. In case of emergency, press the green on-off button. If the orange button is flashing, press verified.
And then it's going to go testing for about a minute.
Testing. Testing.
And it takes about a good minute.
Testing. Testing.
Patience.
Testing. Testing. Ready for use. In case of emergency, press the green on-off button.
So you want it to come back so it says ready for use. In the event that it fails a self-test, it's going to chirp. And I have a low battery here, just to give you an idea. The other thing I should mention, just take a minute. We're recommending when we change the batteries to take a Sharpie and write the date the battery was installed on it. That way we know, and then also noted on the inspection sheet as well. So here's a low battery when we go through that self-test.
Replace battery immediately.
This one's really dead. So it's going to chirp. And if it's chirping, you push the blue I button and it'll tell you what the problem is.
Replace battery immediately.
So it's going to say low battery or replace battery. The other thing that AED does is it will also check the gel moisture content on the pads. So if someone's played with the pads, it's also going to test the gel moisture, and it could chirp due to pads. It's not always battery. One thing I forgot about was in the event you need to replace pads, there's a slider bar at the top of them, and you just pop the pads out this way. And
Insert pads cartridge.
and then you just insert it the same way. Just put it in and pop it there.
Adult pads.
And one of the other things I want to mention
In
is,
case of emergency, press.
and you can turn it off. I want to mention, if you see the pads with the tab sticking out, that should be a little bit of a red flag for you, because sometimes people pull this because they're curious or they've opened it. That's usually a sign that somebody has at least taken the cover off of it. And what you're going to want to do is, if you see that, is look to see whether or not they've opened. If they have, there's a good chance then that the pads are drying out, and especially if you come and the AED is chirping and you push the blue button and it says pads not usable, that's an indication that that somebody has opened the pads. And if you have this seal broken, then the pads are going to dry out.
Self-test. In case of emergency,
And if you put a battery in and you don't want to listen to it go through the self-test like we just did it once, you can hold down the green button. So that's pretty much the inspection of the AED. There's also a fast response kit, and you should have a pocket mask in there, Clairol pocket mask, scissors, razor, gloves, and a wipe. And so you'll check that so that the fast response kit is there and contains all the items that it needs. So that kind of summarizes it. We would like you obviously to note where the AED is. If you open up a cabinet, see that the alarm worked on it. Write down the manufacturer's serial number, model number. They may not all be Philips. They're telling me that they're all Philips, but if it's a different brand, then we're going to write down the same things for that particular brand. It's just I don't know which one it'll be. Again, catch the battery install before date, the date that the battery is installed if you know it. Look to see that there's the spare battery. Look to see the dates on the pads. Check the fast response kit. Check, again, the version if it says Guidelines 2005, and there'll be a little circle around it, or Guidelines 2010. And then just lastly, note the condition of the AED. You know, if for some reason it's damaged or something like that, let us know that. And mark whether or not it's passed the self-test. Then the last thing that I'd like, if you would, is just use your common sense and look at where the AED is located. Does that make sense? You obviously don't want them in a locked room or something like that. You want to look at the placement. If you have any recommendations, maybe, you know, sometimes people put cabinets or posters or block, you know, the visibility of the AED. Take a look at that, you know, signage and things like that. So appreciate your working with us on inspecting these. If you have any questions, feel free to call me or call back to the office, and we'll be happy to answer questions. So appreciate it. Thank you.